Welcome back. As we earlier said, of course, there is a very important campaign that is launched by the Prime Minister, Dr. Mustafa Madbouli, to encourage the citizens to register on a website to receive the anti-coronavirus vaccine, of course, and to assist them on this registration process. There is a campaign that was launched under the slogan, "Together we are reassured, register now." Of course, during the Prime Minister's inspection of the mobile bus equipped for this purpose, that is going to tour a number of governorates to collect the people and encourage the people and take them to the vaccination centers. Of course, he was inspecting that bus tour and was making sure that everything is going on its right course. And of course, this campaign is a very important step to be able to make sure that things are going on the right course, especially with a possible wave that is overwhelming the whole world right now. With us over the phone live now is Dr. Ramy Aziz. He is a professor and head of microbiology and immunology research program at one of the very prominent Cairo hospitals. Good morning, Dr. Ramy.
Good morning.
How are you doing, sir? How important is to allocate the qualified community communication teams to respond to citizens' inquiries and questions, responding to their requests, and work to overcome any obstacles that are coming in the way of the completion of the vaccination process?
Good morning. It is quite important now to vaccinate as many people as possible, especially we are at the end of summer, and this season is very well known for increased incidence of most of the respiratory virus, including the coronavirus. Last year we have had a peak in the fall, in the start of the autumn, and we are still behind in how many people to vaccinate. So we have a lot of people to vaccinate in Egypt. So it's really, really important to have these campaigns in different governors and to have follow-up with everybody who registered to make sure they know where to go.
Right. Tell me about that particular initiative. It's very important because it's urging people to go to vaccination centers and to register on the website. Of course, there are some sectors in society that would probably lack awareness of the importance of the vaccination process, especially with the upcoming wave that is expected in winter. I mean, it has been overwhelmed worldwide in some countries. How important is it?
Yeah, it's very important, and public health campaigning is a science. There are experts in this, so they know how to address every group of people. Some for example, some people who are individualistic in nature and who like to follow news themselves, they like to register on their own. But other groups may prefer to go together, and this is what we are seeing now. For example, at Cairo University and at different universities, I was just randomly examining some students last week, and you can see lines of students and workers at the universities waiting for their turn in taking vaccine. So this is one of the ways to do it, is if some people are hesitant to go alone, when you go with your colleagues, of course with keeping the distance, I'm not talking about crowding, but when you vaccinate, for example, the students class by class in the university, and hopefully very soon in schools, because the minimum age is still 18 years, but in the US it went down to 16 and then to 12 for one particular vaccine, and we are waiting for other vaccines to be approved for younger adults, for youth and younger adults. So this will make a big change, because Egypt has a large number of youth as well. We are one of the younger populations. So when you can address universities, schools, and then later, hopefully also in villages. I know that there are campaigns in all governorates, but some villages, the farmers think that because they are working in a farm, it's open, it's outdoors and they are safe. Of course, they are safe outdoors, but when they go to prayer, or when they go to a funeral, or when they go to a wedding, they will not be safe. So it's really important to reach every person in Egypt who is eligible for vaccination.
Right. Of course, there is also something that might come as a common inquiry amongst citizens, which is the different types of vaccines and which is much more suitable for each person. I mean, how is it regulated? Are there any differences between those types? I mean, this is a stronger...
Yes, there are differences, but most... so the golden rule is any vaccine is better than no vaccine. So this is the rule number one. So if we can pick any vaccine, and it's not a one way to go. So for example, next year, if I took vaccine X this year, next year I may be able to pick another one. But for now, we need to vaccinate as many people with any vaccine available. It's really hard to make choices. Except, now this is to answer your question, except that some particular cases, for example, people who are taking drugs that increase their immunity, for example, anti-rheumatic drugs or chemotherapy, cancer patients. There are some vaccines are safer for these. For example, the inactivated vaccines like Sinopharm and Sinovac, they are safer for people who have weaker immunity. However, they may need more doses, and this is being researched now. On the other hand, as you heard earlier, for example, some vaccines like AstraZeneca, for young women, women in the ages of 35 and lower, it's not the most recommended vaccine for them. So all this information is at vaccine centers. When you go to a vaccine center, when I went myself early this summer in April, actually in the spring, I went to get vaccinated. They asked me questions and they told me, we will give you this vaccine because of this reason. So we have to trust the vaccine centers are very well educated people. Most of them are volunteers. So we have nurses, we have pharmacists, and we have physicians, doctors. So it's a whole medical team there who can help with any of the inquiries. We have to trust them because they are really doing a great job.
So they would interview whoever is going to be vaccinated, and then they would suggest the most suitable vaccine for each citizen, or you go just immediately to be vaccinated?
Yeah, usually there is one vaccine that is available for everybody in the vaccine center. However, for some special cases, as I told you, like elder patients or those who are being treated or those who have weak immunity by nature, there are some doses kept for them of a different vaccine. I don't want to go into details, but there is definitely a backup. Nobody will give somebody a vaccine that is dangerous for them. That you have to be assured of this.
Exactly. I was about to ask you about senior citizens, because some senior citizens are suffering from chronic disease. What about the people with chronic disease? Am I supposed to check myself up medically before going to be vaccinated? Am I supposed to be, the respiratory system is clear from any difficulties or problems? I mean, these are all common questions.
Actually, for older individuals, actually, most of the vaccines are really good and effective. So, for example, you have seen in England, the first person who got one of the vaccines was 99-year-old. However, as you said, some chronic diseases like diabetes, like rheumatoid arthritis, some of the diseases that require an immune stimulatory drug. I'm sure people who are taking these medicines, they know they are taking them, so they can tell the doctor. If they don't remember the medicine name, they can bring their medical record, or they also have their own doctor treating them, their family doctor, who is following their chronic disease, and the doctor will advise them. My advice now is anybody who has any chance to take a vaccine, please do it immediately.
Right.
Today is better than tomorrow.
So according to your own assessment, how important is the media and social media when it comes to the element of awareness? Do you think that those campaigns should require a great deal of awareness amongst citizens?
The media are very important. The social media are important. However, they are double-edged sword sometimes, because we see a lot of information that is baseless. Some people have some strange hypotheses about vaccination in general. Like there is in some countries, especially in France, in the US, there are campaigns against vaccination of all sorts, and they unfortunately they invade the social media with very misleading videos that are all based on lies or legends, like what we heard very early last year, that some people are inserting chips under the skin. It's very unfortunate that this nonsense is making its way to the media. So the media are very important, and believe it or not, even, for example, I was in the US, I had a conference in the US last month, and thank God I could travel because I was vaccinated and I was tested negative as well. So when I went to the conference, I was just listening to the radio in the US. Every 30 minutes there is a message on the radio. Even in the United States, the largest, one of the richest countries in the world, and one of the highest vaccinated countries, maybe 60% are vaccinated, they are still having messages on the media, please go get vaccinated, vaccines are important. So the media are very important. However, some people don't listen to the media. Some people will need to be convinced from their peers. Some people need to be convinced from their own doctors, they trust them. So all of us have to work together because we work in the healthcare system. We have to work together and the media to make sure we provide information that is scientific and that is, it's also urgent. We are in a war. We have to say this. We are in a war with the virus. The pandemic is similar to a very big war. It has killed more people, I think, than most of the wars. So when we are in a war, we don't have the luxury of saying, I will wait 1 more year for a better vaccine to come. We are in a very tough situation. Some people have forgot how hard it is, and we got used to the number of dead people that we read about in social media. This is not good, especially for the older people. Most of us, if not all, we have lost at least one family, older family member, and this should not be the case, really. We are in the year 2021. We have a very good health system. We have to avoid getting COVID by any way.
Right. Another important question that might force itself. What about the different strains of the pandemic? Would it require different vaccines? Which means, in other words, that this vaccine won't be valid for the coming strain or another different strain?
Every day there is a new variation in the virus, but for now, until now, all the vaccines available are efficient against all the variants at different degrees. So it's not 100%, of course. Nothing is 100%. So, for example, we heard about the Delta variant. The vaccines are believed to protect people from the Delta variant. Even people who got vaccinated, and it's true that some people got vaccinated and fell sick again, the disease was much milder than what it will be. It's because of vaccination, not because of the variant itself. Some people say the Delta variant is less dangerous. That's not true. The Delta variant is believed to be spreading a little bit faster, not very much faster, but a little bit faster. And it's similar to the older virus, except that when people are vaccinated, they get much better outcomes. Nobody gets, very, very few people in the world died after vaccination and infection. Very few people.
On this note, Dr. Ramy Aziz, Professor and Head of Microbiology and Immunology Research Program at one of the prominent Cairo hospitals, would like to thank you so much for your time, and you have a good day. And I guess this would end this edition of the Breakfast Show for this morning. Many thanks to all of you. Until you see you again on a new edition tomorrow morning, that's a goodbye, and you have a good day.